Okay, so I'm going to hand you over to Nadia now, who's going to be our chair for this afternoon session. And another really exciting lineup for this afternoon. So I'm really looking forward to everything we're going to learn today. Over to you, Nadia.
Okay, thank you very much. Can everybody hear me good and well? Okay. So welcome to this afternoon session. We have live captioning with a great lady behind the screen to support us in this session. We have three international sign language interpreters with us that we will thank in advance already. We have three great panelist speakers who will share with us their expertise on how to develop disability inclusive preparedness and planning. So our first speaker is Sébastien Jodoin. He will come with a perspective on climate, and he is from the McGill University. He's an associate professor in the Faculty of Law, where he holds the Canada Research Chair in Human Rights, Health and the Environment. He is the founding director of the Disability Inclusive Climate Action Research Program, a pioneering initiative to generate, co-produce, and translate knowledge and the intersections of disability and climate justice. Well, Sébastien, welcome between us, and the floor is yours. Sébastien is with us, he's joining online. So if you have any question, you can already write them down. People are following us online, put it in the question and answer box, or put your question in the chat. So Sébastien, the floor is yours.
Well, thank you so much, Nadia, for that introduction. And a few days after I introduced you at our site event in COSP in New York. So pleased to join this panel. I'm going to share my screen. I need, yes, thank you. No, I need the host to end their screen sharing so I can just share my screen. Okay, perfect. Okay, so I've been asked to discuss and present on disability inclusive climate adaptation. I do have slides, but I will be describing them as I go along for anyone for whom this is a barrier. So I want to start by presenting a standard model of how we understand climate vulnerability. And we now understand climate vulnerability as primarily made up of three components. So the first is exposure. So based on where you live or what you do, you might be more exposed to different climate risks. Sensitivity. So based on your based on your inherent characteristics, you might be more sensitive to different climate impacts. Then there's adaptive capacity. So this is the assets, the relationships, the access to institutions and services that allow you to cope with climate impacts. And these three things together are what are going to exacerbate, reproduce, and generate climate vulnerability. And what I want to explain now is that a number of these are actually tied to disability in some ways, and ableism. So if we think of exposure, we know that you might be more exposed to certain types of risks if you are in an institution, if you're institutionalized. And we know for sure as well that if you have, due to ableism, you may have fewer resources, fewer access to services to cope with climate impacts. And so ultimately, then climate vulnerability can actually reinforce the sort of effects of the systemic barriers that people with disabilities will face. So there's a very strong connection here between basically the barriers that people with disabilities face in everyday life and the types of risks and impacts that they're exposed to as a result of climate change. So in the field of climate adaptation, we will consider that effective climate adaptation policies are those that will address and reduce the effects of systemic inequalities in climate adaptation. And so here I'm not just referring to the systemic inequalities faced by people with disabilities, but also those faced by women, minorities, children, youth, indigenous peoples. And of course, through an intersectional perspective, we can see that these, of course, are reinforced for people who belong to more than one of these groups. And conversely, what we call maladaptation are policies and programs and decisions that will reproduce, even exacerbate, the effects of systemic inequalities in climate adaptation. So I'll give you an illustration of maladaptation that is from my hometown of Montreal here in Canada. And so in 2018, there was a heat wave, July 2018, a heat wave that killed 66 people. Half of these people had a disability. A quarter had cardiovascular or diabetes, but a quarter had schizophrenia. And this is a mortality rate that is 500 times greater than their share of the population in Montreal. So how can we understand this effect? And we can first of all see that having a disability will expose you to, will lead you to have fewer resources to cope with a heat wave. We can also, we also find that if you're in this, having disability will lead you to having fewer resources, fewer access to social networks, social support, and finally that most importantly, I would say that the city had nothing planned, had nothing, no programs in place to reach people in this segment of the population and to ensure their climate resilience. So for me, this illustrates very clearly the way in which underlying barriers faced by people with disabilities and also barriers within the context of climate adaptation, how these can actually lead to climate vulnerability for people with disabilities. So I want to shift now to basically looking at what we should be doing about this. So first, I want to mention that the Paris Agreement, which is an instrument adopted under the United Nations Framework Convention for Climate Change. This is an agreement that is meant to govern climate change in the long term and was adopted in 2015. The preamble to this agreement says parties should, when taking action to address climate change, respect, promote, and consider the respective obligations on human rights. And the preamble also specifically mentions persons with disabilities as a group whose rights may be disproportionately affected by climate change. So the states parties to the 192 state parties to the Paris Agreement have recognized that states need to respect their obligations to people with disabilities under international human rights law when acting in the field of climate change. And it goes without saying that the UNCRPD applies to climate adaptation policymaking. There's no exception, even in the context of emergencies that might result from climate change. The treaty does not allow for derogations of human rights obligations, except in the most exceptional circumstances that threaten the survival of the nation. So nothing, basically the UNCRPD applies. And all of the articles apply and are potentially relevant to climate change, but I'll just mention three that I'm sure many of you will be familiar with. Article 4, which obliges states to consult people with disabilities and consider their rights in any policies or programs that concern them. Article 11, which obliges states to ensure the safety and protect the lives of people with disabilities in disasters, including the types of disasters and emergencies that might be fueled by climate change. And finally, Article 32, which is about international cooperation, and would therefore apply to the policies and programs of developed countries, industrialized countries, and the obligation to support efforts to enhance the climate resilience of people with disabilities in developing countries. Okay, so that's sort of the background for why and how disability rights would apply to climate adaptation. And last week, my team and I, and in collaboration with the International Disability Alliance, we released a report where we systematically analyzed disability rights in national climate policies of the 192 state parties to the Paris Agreement. I will just present briefly on our findings in relation to climate adaptation policies. So we found that 45 state parties to the Paris Agreements referred to disability in their climate adaptation policies. To be clear, when I say refer to disability, I don't mean language that refers to the rights of persons with disabilities or even refers to them as persons with disabilities. If we had used that as a standard, we would have found almost nothing. So instead, we looked for any references to disability, including medicalized terms like people with chronic illnesses or people who are who have health conditions. And so using this more expansive definition of just any reference to disability, we found that only 45 out of 192 states referred to disability in their adaptation policies. And you'll notice, so I'm showing now a map of the world with in green the countries that do refer to disability in their adaptation policies. And you'll notice that Africa is the continent that seems to have a lot of references to disability. And overall, you can see more references to disability in countries of the global south than in the global north. And this is because these adaptation policies are often funded by bilateral aid agencies. So the UK government, for instance, has very strong emphasis on ensuring that any development aid and policy work that it supports will be disability inclusive. Ironically, these same countries that are funding and requiring states to refer to disability in their climate adaptation policies don't do so in their own national policies. I'm now showing you a chart that just to give you a sense of where people with disabilities stand in relation to other references to marginalized groups. So in the context of this research, it's a bigger research project, we also looked at who are the other groups. Well, in general, we looked at which groups of rights holders are referenced in adaptation policies. So you can see that there's more references to the poor, to children, to women, and the elderly than there are to persons with disabilities. And fewer still references to indigenous peoples, migrants, and ethnic minorities. My point in showing you this is that basically states are starting to, for instance, refer and include women and children in their adaptation policy making. So they're understanding that there are groups that are disproportionately and differently affected by climate change. So once you've made that leap, then it's incumbent on you as a state to also include people with disabilities, which is one of the groups that that is recognized as, alongside women and children, for instance, as being disproportionately affected by climate change. Okay, so the key takeaways from this research is that less than 1/3 of states mention disability in any way in their climate adaptation policies. Most references to disability in these policies are vague. So usually it's just a list of vulnerable groups, and people with disabilities will be lumped into this list. And we could not find any policy that had actual concrete measures to protect the rights of persons with disabilities in the context of climate adaptation. And this is a more general takeaway, but it's basically that excluding persons with disabilities from climate adaptation policy making only reinforces social inequities and, of course, undermines the effectiveness of these policies. So we do have evidence from our other work looking at, for instance, gender, that when states consult women and use a gender-based approach to adaptation policy making, that their policies are actually much more equitable and much more effective. And then finally, it is obvious from this work that state parties to the Paris Agreement are not complying with their obligations under the UN CRPD in the context of climate adaptation policymaking. So I want to close with sort of 3 reflections as to what all of this means and what we should do about it. So the first thing that can and should happen is litigation. Litigation seeking to hold governments accountable for their failure to include people with disabilities in their adaptation policy making and for the impacts this has on people with disabilities. So there is a case that I can point to, which was launched against the City of New York by the Brooklyn Center for Independence of the Disabled against the City of New York in 2013. And I'm showing you here a picture of a hurricane shelter where basically 2 pieces of wood were sort of hastily put together at the very last minute to make some kind of makeshift ramp to get into this hurricane shelter. So in 2013, in the context of Hurricane Sandy, people with disabilities in New York discovered that basically nothing had really been planned to evacuate them, to ensure their safety in the context of this hurricane. So they sued the City of New York. They were successful in their lawsuit. And the result was a comprehensive settlement that actually really outlines quite specifically all of the things that a city should do to ensure that its disaster risk reduction plans, disaster risk readiness plans are disability inclusive. So I highly recommend looking at this case and the settlement. But again, just one example is that many of the hurricane shelters were not wheelchair accessible. So I think there's a lot of potential for more litigation in this area. Now, in terms of how we can design disability inclusive climate adaptation, there's a number of key steps that are needed here, and they're all basically taken from the UN CRPD. So the first is really just ensuring that the rights of persons with disabilities are respected, protected, and fulfilled throughout all the stages of adaptation policy making, so design, development, implementation, monitoring, and evaluation. The second is ensuring the meaningful, informed, and effective participation of people with disabilities in climate adaptation policy-making and decision-making processes. So this requires making the information accessible, making consultative mechanisms accessible, and also making those consultative mechanisms meaningful in the sense of actually having influence on decision-making that affects people with disabilities. Of course, states have to adopt and implement adaptation policies that will actually enhance the resilience of persons with disabilities to the various different climate impacts that may occur. And 4, in doing all of this, it's essential that states adopt an intersectional perspective that recognizes and addresses the multiple barriers faced by women, children, racialized minorities, indigenous peoples with disabilities, and also underrepresented groups of persons with disabilities in the larger disability community. And then finally, this is a key step for donor countries and international institutions and organizations, is the importance of supporting international efforts to enhance the climate resilience of persons with disabilities in developing countries. So Again, I'm just going to refer to a number of European countries that have programs to support gender inclusive climate adaptation in sub-Saharan Africa and East Asia. And we need similar programs for persons with disabilities. So ultimately, the goal here of all of this has to be to empower people with disabilities. So I'm showing here an image of activists in Toronto that installed these makeshift ramps as part of a campaign to enhance accessibility of businesses, and also pointing out the gap in the terms of enforcement of disability inclusion in terms of accessibility. I'm showing you this picture simply to illustrate the point that people with disabilities have tremendous potential as experts, as knowers, as makers, as doers in adaptation. I like to think of people with disabilities as experts in resilience, which is required to navigate the various barriers that we confront in life and across different systems. And so this expertise and this knowledge needs to be brought into the field of climate adaptation policymaking. And then finally, doing this will, of course, have important resonant impacts. So by designing adaptation policies that are in line with universal design principles, you will have more effective policies, not just for people with disabilities, but actually protecting a larger share of the population. So I'm showing here an image of different forms of disability inclusive climate communication. And the point is, if you have early warning systems, for instance, that warn people of a climate impact in a way that's accessible, and you reach more people who may have sort of barriers in terms of other forms of communication, again, you're not just reaching those people, but you're actually increasing your ability to reach a larger share of the population. So if you are interested in finding out more about this work, including the study, and you can find also all of the references to the disability that we included, that we found in the climate adaptation policies on our website at disabilityinclusiveclimate.org in French, English, and Spanish. Thank you so much.
Thank you very much, Sébastien, for sharing with us, reminding us the why we should include persons with disabilities and linking them to the different articles. Also, the engagement of the governments, that they should not forget that they are responsible for ratifying the convention, that they should protect, promote, and fulfill. And then sharing with us the outcomes of your study that we encourage everybody of you to consult directly on their website. Thank you, Sébastien. So our next speaker from conflict perspective is Yuliia Sachuk. She's a self-advocate, she's a feminist, coordinator of the National Human Rights Defenders Network of Persons with Disabilities. She's the head of the Fight for the Right OPD and Disability Research Center. Yuliia contributed to the Electoral Code of Ukraine. She's a member of the Accessibility Working Group at the Central Election Commission, and her scope of expertise includes intersectionality of social identity, advancement of human rights-based approach to development, business and human rights, ableism in politics. The floor is yours.
Thank you. Good afternoon, everyone, and thank you for the opportunity to be here. I'm also an LLM student, and for me it's a great honor to speak to you today, and thank you all for supporting Ukraine during the Russian war in Ukraine and genocide against Ukrainians. Today I will be speaking about, as a chair of Disability Rights Organization, I will be speaking not such more about legal framework, because I think yesterday our speakers presented all of what we have in CRPD and another human rights documents. And I want to present you our emergency response during the Russian war in Ukraine, which we created because we didn't find even a response of our state and international organization helpful enough. And what we learned, and the main lesson what learned is that nobody would care about us, those with disabilities, better than we by ourselves. And I think we we made this historic turn not to be just objects of humanitarian actions, but also subjects. So before war, we as a human rights organization worked on strengthening disability movement, mainly through empowering political participation in political area. Also, we built National Disability Defenders Network, and we were fighting for CRPD implementation. We helped our state in different areas, cultural rights, political rights, accessibility, statistics, and also promoting disability inclusive democracy in Ukraine. How to make the next slide?
Find a famous button.
Yes, this is our team. We were an organization of people with different types of disability, and were near 12 of us. And now we helped more than 1,913 people with disabilities in Ukraine during the war. We spent, you can see numbers, 200,000, 15,000 of dollars, and each case, so each request, it can be from $10 till $9,200. This is, for example, cost of one medical evacuation from Ukraine to abroad. And during the as a LLM student, I think months before war, it was my personal initiative to start to prepare when we had all discussions about possibility of Russian invasion of Ukraine. I was doing this by myself and was asking lecturers and was asking people whom I know from disability movement to share with me different resources, and I was trying to push our national authorities to do their best to be prepared. But I also was trying to reach different UN agencies on this, and some organizations really sent me good practices, standards, but they were from abroad, and Ukrainian national legal framework very often doesn't allow to do the same or needed some amendments, and we had very limited time. But I received resources, I have read them, and as minimum understood where to go and for what to be prepared. Then experts as well were I received the contacts, and regarding finances, we started in organization to provide people with disabilities with psychological support. We didn't have any money for this, so we organized on GoFundMe platform to collect money just to pay our psychologist for such services. And in this, again, my classmate Avery Horn helped me to organize platform on GoFundMe. And needs, we organized also, we asked our community, our national disability network, how did they feel, what did they think about possibility of war, about their ways of surviving, who can help them. So we received answers and understood that people with disabilities in Ukraine didn't know what to do. And for example, you can also imagine the situation. For example, please think or remind, do you have accessible bomb shelter in your house, or do you have accessible transport in your city, village, or location, and do you have a warning system with accessibility? So we understood that we didn't have anything, but we were trying our best to do what we can do. So we prepare approximate evacuation plan for our team, Fight for Right organization of people with disabilities. We prepare some support, I mean mostly financial and resources and contacts for our members of Disability Defenders Network. We also connected with our donors, among them International Foundation of Electoral System, National Endowment for Democracy, and they were also supportive in regardless to spend some of our project's money for maybe our evacuation or something like that. And GoFundMe platform, as I said, and contacts. On February 24th, when the war started, I was in my apartment in Kyiv with my son, and in my I didn't have and don't have bomb shelter in my house. So since the second part of the day, I spent in bomb shelter, usual subway station, and was trying to organize evacuation of the team. This first day, we were doing a lot of media with international, especially international media, and posting on social networks like Facebook, Instagram, Twitter, what is happening. And on this, our colleagues and friends from abroad were very helpful. So on the first days of the war, we were prepared. We have our emergency bags. We had money in cash. Our team, I mean, printed contacts, not just phones, batteries, but printed as well, tickets and transport available with enough of oil, psychological support, mostly our friends from abroad who were not such involved in their surviving, and people ready to help, mostly also from abroad. And regarding what we were doing the next, as we evacuated our team, many of our members of Disability Network started to contact us to help them, then their friends, then their friends. They used our hotline for psychological support, so organically this hotline became hotline for request for help, different help, but we started to receive a lot of requests. In the beginning, we were trying to understand who in Ukraine can do this work, how to connect these people who need help with those who provide this. But we were not successful in this. Most our state authorities, like we have ombudsman's, president's advisor on disability, most of them disappeared. So we, based on our experience, started to provide such support, even consultation, just, I don't know, to connect people with available transportation, just to support them during their way, to describe how it's possible to escape the cities under bombing. And but our platform on GoFundMe, as the war started and attention was very high, people started to donate. This number is for today, and you see that more than 6,400 people donated us money. And for me, it's very important to know that many of these donations are from people with disabilities around the world. And we started to organically build our emergency mechanism, new and which not, I don't know, which didn't exist organically, but using this money. And for example, we received a lot of comments, and you can see that money really from people with disabilities who knows that their chances for surviving during the war, during direct bombing and muslins are very low. Also important moment about our emergency response that in accordance like all our system, I think in accordance with CRPD and Article 11 and another articles, because it is firstly from community for community, it is also disability led. And our partners, I think third day of the war, we connected with Partnership for Inclusive Disaster Strategies organization from US, which works with disasters and other catastrophes, and World Institute on Disability. And it's also a very interesting moment because in Europe we have a lot of organizations, and it's like logically that we could be connected, for example, with European Disability Forum or another European organization. But these organizations were first, and they were very supportive in the meaning of experience, because they had such experience working on emergencies, and they proposed us to help, and it was very direct support. As well as I mentioned before, my classmates at lectures from National University in Galway and Obama Leaders Europe Fellows, where I am participant and first Ukrainian, they helped a lot with direct support for evacuation of our team, because this group of 35 people in different countries of Europe with different positions, some of them are members of European Parliament, some of them are civil society activists, but first days of the war, after border crossing, they cared about all our people. They provided transportation, accommodation, food, money, and everything. And these people are not disability experts and not humanitarian activists as well. And so we I think some weeks later we understood that we created something new, and even to cooperate with, we were trying to cooperate with existing mechanisms like UN Protection Cluster, big international organizations, and other clusters which exist in Ukraine. But regarding direct support, they were not helpful. And our work was and now look like this. We provide support 24/7. We have hotline and taking requests from people with disabilities or members or friends from all peoples. We have more than 25 case managers. Also, many of them have disabilities. They are from Ukraine and international. On the beginning of war, all of them were volunteers. Now, some of them receive salary, some of them not. Continue to volunteer, but this work is very exhausting. And also, we structurized the work. For example, person who use wheelchairs now is responsible for providing and assistive technologies like wheelchairs for Ukrainians with disabilities, because she is expert on this and in another areas. We created a database of cases in Airtable and a database of resources in Airtable. Resources, I mean resources of accommodation, resources for of another organization who provide another services in Ukraine and in Europe. But now we have structure, and it's very easy to use such databases. Case managers chat in Signal, so we can communicate around the clock. Instructions and standards of work. We follow, as I mentioned before, human rights approach. We provide support with respect for person, with respect to dignity. We are not doing in best interest, but we try and really to provide support which this person need according to his or her request. We also have create a new system of payments because, as I mentioned before, we were not very big organization, so now our system of payments is very operative, and we also try to create system of verification. If anybody have some standards, I will be very thankful. Mostly this work like recommendations, some documents, but we understand that providing humanitarian aid, if you provide humanitarian aid, there will be a percent of people who will use this not for our aim, but we accept this. Also, we work individually. I think each 2 weeks we organize needs assessment because the situation is changed every time. And when we talk about the beginning of war, it was really surviving, saving life. Now it's more about people who needs medicines, food, water, and a lot of information and services are available, which were not available in the beginning of war. So we try not to spend our resources and money for that work which can other organizations do. We also continue to work with international volunteers, and we coordinate our work among our partners organizations. Which support we provide? From the beginning, from the first days of war until now, we provide evacuation. For evacuation, we use like regular green corridors, state official. We also use services of rescue group, not only Ukrainian, and we pay for them money. We also use volunteers group which exist in Ukraine for evacuation, especially from very dangerous area, from occupied territories. And we provide medical evacuation. On this, we work with some hospitals. This evacuation for people with really severe disabilities or health conditions. And this evacuation means that we evacuate person from her home or hospital to another hospital. And this is also very expensive kind of activities, beginning from $5,000 each. Also, we provide support with usual transportation. In the beginning of war, we didn't have any vehicles, but now we have 3 accessible, and also we use existing usual transportation ways. We buy people tickets, another our kind of activity. We even bought and continue to buy tickets for Kett, as you can see, because during the war, Kett and dogs in Ukraine in some transportation companies also need tickets as people. Yes, and also we provide basic products like food, hygiene products, medicines, assistive technologies, but also individually. Medicines, as I mentioned, hearing equipment, white canes, crutches, everything, because very often people are also regarding physical disabilities, even when they evacuated by general ways, they evacuated without their assistive technologies. And this is terrible, as I think. So here is the whole list of our services. One-time financial support for families and for people with disabilities in Ukraine and abroad. And this moment also important, we provide support as for people who are staying in Ukraine and for refugees abroad. Medicines, urgent medical services, assistive technologies, accommodation, personal assistance, legal advice, psychological support, food, water, hygiene products, rehabilitation, and consultations general. How it works, this is part of our database on our table, but important is that it's really individual. Also, we use not Washington set of, but something similar. As minimum, we ask about type of disability. So it's continued. It's not on the screen, but we know the type of disability. Also, we work with elderly people, people with severe disease, and yes, so and providing support for people from other minorities. What our main goal in the beginning of war and now is still saving lives and urgent help. On this, it's not results or conclusions, but what is important to stress that more of 90% of bomb shelters in Ukraine are not accessible, and I don't think that in many countries this number is better. Lack of information in accessible formats before war, in the beginning of war, and now. Gaps in laws and regulation and logistics, and this challenge face big international organizations and state authorities. Lack of coordination of humanitarian actions, and for me personally and for our team, this is one of the biggest challenge, because even we trying to connect with existing mechanisms, we understand that there is no place for us. We were not involved in the beginning or when international humanitarian law was developed, and to follow these rules is not possible when you provide direct support. For example, each organization has its mandate. For example, they can't evacuate people from 3 kilometers zone to where is the war, or they can't answer for calls, and they exist, but we couldn't create a good cooperation. As well, disability is not visible and it's not included enough on their policies. I had meeting with UN protection cluster before war, and I had very directly questions regarding how many accessible transportations they have, how they reach, for example, deaf people and people with hearing impairments, and I didn't receive answers. So this is cluster which include more than 60 organizations in Ukraine. Institutionalization. It's a big problem not only for Ukraine, and our capacity on working on this is very limited. We are trying to do our best in area of advocacy, and I'm very thankful for speaker today from UNICEF to present their work, but it's really terrible to see how big international organizations accept and tolerate such situation in Ukraine, and even support in their I don't know, in their providing support. And regarding humanitarian aid, this is data from another human rights organization in Ukraine that only little number of money goes to organizations it's not about disability organization in general, non-governmental organizations in Ukraine. So we have limited very financial resources for provide our services. As well, we are trying and succeed in doing our media work and communication from the beginning of war and till now. We cooperate and with big international media like Washington Post, Times, and other, as minimum to make this problem visible, and as minimum to share experience of real Ukrainians with disabilities and challenges which they have during the Russian war. And also we are trying to do our advocacy work and policy papers on state situation with people with disabilities, human rights during the war. On March and April is available overview of the international humanitarian organization works on the cooperation with PVD when planning emergency response, women with disabilities during the war and place of freedom deprivation in Ukraine. We just started this work, and also very important for us area is disability war crimes. We are not big experts on this, but we cooperate with the biggest coalition in Ukraine who documents war crimes, and we will start do our best as minimum again to make this problem visible. Our support, as I mentioned before, we didn't and don't receive any support from big international humanitarian organization who provide support for Ukraine, but we succeed to cooperate with big businesses and the social, which are social responsible, like Google or Nippon Foundation, National Endowment for Democracy, Global Children, and others. Here is our contacts, and if you need any information about situation with Russian war in Ukraine and people with disabilities, you can contact us. And for me personally, again, I'm very thankful for University in Galway for providing me personally, our team, and all Ukrainians with disabilities support, especially in expertise and volunteering in the beginning, especially of war. Finally, and as conclusion, I was fighting, as I told yesterday, I was fighting for UNCRPD realization in Ukraine more than 15 years. I really believed in it. And I don't know the ideal situation when convention could work, but now it doesn't work. And I don't know, and I'm not sure where is the problem. Is it about state obligations and not a desire to comply, or other? But I think that urgent actions needed, because providing direct support for people with disabilities wouldn't possible in the beginning of war, and now we see that our organization and organization of people with disabilities are main providers of such support. And stop the Russian war against Ukraine and stay with Ukraine. Thank you.
Thank you very much, Yuliia, to share with us from personal perspective, and also reflecting really the reality in case of conflict situation, how people with disabilities are just really left behind, and thanks to your activism, I think, and thanks to very motivated people that you furnished direct support and help for as much as you could. Apparently, you reached more than 1,900 people directly. That's really brave. I'm just wondering sometimes, where was the government in those cases? Okay, there was war, but they forgot most of the time those who are the most in need, and very brave that you work also intersectional with elderly people. We still have some time for question and answers. So I will take some questions from online. We have Shaina Shane from Inclusive Asia. What may I have your attention? We're going back online. We start again. Thank you very much. So last but not least, we have Kett with us. She's the Associate Professor in Humanitarianism and Disability in the UCL Institute of Epidemiology and Healthcare. She's an anthropologist by training. She has extensive expertise in disability, inclusive humanitarian responses, global health, human rights, climate change, poverty, elevation, and the consequence of social exclusion. She's also an author of more than 100 publications. Ari, the floor is yours, and you can fill in.
Thank you, Nadia. Thanks. And it's really nice to see so many familiar faces here. And I'm also very conscious that I'm following Yuliia, who gave us a really very impassioned and really very topical sort of picture of what it's like to live in a war zone as a person with disability. I'm going to pick up on some of those things that we've talked about a little bit today and focus on a really specific area. I'm going to talk about assistive technology in humanitarian contexts. We touched upon this a little bit already today, but I want to come down and dig a bit deeper. This is from some work that I have been doing as part of a project called AT 2030, which is led by the Global Disability Innovation Hub, which is based at UCL. And the hub is a practitioner-focused, partner-focused initiative, and it's really trying to develop and drive disability innovation for a fairer world through disruptive partnerships and innovation. We do it through research, innovation, programs, teaching, and advocacy. I can tell you more about the hub after, or you can look us up. The AT 2030 programme is funded by the UK Government, the Foreign Commonwealth and Development Office, and it has 4 clusters: data and evidence, innovation, country implementation, and capacity and participation. And this research that I'm going to talk about today was done under the data and evidence component, and I'll show you the references to the literature after. We talked a little bit about assistive technology, or AT, today, but I think it's really important to define what we mean by that. Otherwise, we're all talking about slightly different things. Many of you might know the Global Report on Assistive Technology has been recently launched, a combined effort between UNICEF and the WHO. And in it, the report is very clear that assistive technology, or AT, is an umbrella term for assistive products and their related systems and services. And that's really important. So oftentimes when we talk about AT, we're just talking about products, wheelchairs, hearing aids, whatever. But we often forget that it's part of a wider system. And oftentimes it's that system that we need to address. And I think that's partly what Yuliia was talking about today. It's the system itself that we need to be thinking about, how that needs to become more inclusive. We've also talked a lot about the humanitarian context, and I wasn't here yesterday, so you might have already had lots of discussions about some of the terms that we've heard already. I've used, or we talk about humanitarian context to think about when the impact of a crisis exceeds the ability of the affected community or society to cope using its own resources, and therefore requires urgent action. It can be slow or rapid onset, it can be in rural or urban environments, and increasingly it is in urban environments, and oftentimes these are complex political emergencies. And oftentimes we talk about disasters, and we can debate endlessly about the term natural disasters. Most of my colleagues would argue there is no such thing as a natural disaster, only an anthropomorphic hazard. Conflict and emergencies. But the point, and I want the bit, is that the state, it exceeds the capacity of the state to cope. And I think Yuliia gave us a really clear example of how the state can no longer manage to support its own people. You're all lawyers, you know the rights you have as a citizen of a state, but when the state can't manage that, what happens to those rights? They sort of go out the window. And Yuliia also talked about the cluster system, and I don't know yesterday if you did anything about the UN cluster system. I'm looking at you, Anya. Just to say briefly, the UN cluster system is what the UN use to respond to. It's led by a humanitarian response coordinator, and there are 11 clusters. It includes health, education, what have I missed off? Protection cluster, there are 11. I can talk about them after. But the point about them is that they are led, each of them, by an agency. So what we see is that humanitarian contexts are increasingly complex and long. I guess we're not necessarily going to see any resolution in many of the humanitarian contexts around the world anytime soon. Yuliia spoke about Ukraine, but we could be talking about Syria. We could be talking about many of the other conflicts going on in Ethiopia, Eritrea, etc. around the world. What we do know, and this has been very clear from all of the presentations, is that there's a lack of provision of services for persons with disabilities in these situations. And I've been doing research for a very long time. And unfortunately, what Yuliia said, I think we could have said that 10 years ago for other countries. So I guess the question is, why is it not changing so quickly? From our perspective, from the work we've done, there's actually been very limited evidence about assistive technology or the provision of it in humanitarian emergencies. So what needs to be done and what works? But one thing we do know, and again, I think Yuliia touched on this, and so did Kirsten this morning, there are lots of guidelines and standards that tell us what we are supposed to do in humanitarian action to ensure disability inclusive humanitarian action. Most of these, or almost all of them, are underpinned by the UN Convention on the Rights of Persons with Disabilities. But, and I think again this has been clear, are these standards and guidelines translating into action? So, for example, in the work we do on assistive technology, we know there are many, many guidelines and standards, but actually they haven't really given enough specific focus on the use or the role of assistive technology to support the rights of persons with disabilities in humanitarian situations. So this lack of evidence is really hindering, I think, our ability to act, because oftentimes we know that there are lots of standards with very good processes, but actually how you deliver those in practice is more complicated. And what do I mean by that? So there's lots of sets of principles for action. We will be disability inclusive. We will ensure that our work abides by Article 11. We will ensure that it, it work with people with disabilities, organisations of persons with disabilities. But the question often is the next bit, the bit Yuliia told us about, doing the what specifically. And that can be the challenge, right? So for example, some of you might know that there are humanitarian inclusion standards for older adults and persons with disabilities. These are freely available online and can be downloaded very readily, and I put a link to them. In those inclusion standards, there is a specific section on assistive technology, and it talks about 3 areas in particular. Procurement, hold that thought, I'm coming back to procurement. Principles of universal design, particularly working with organisations of people with disabilities or other community-based organisations. And again, I think Yuliia gave us a really good indication where that relationship may not be so successful. The guidelines also talk about using different formats for accessible information to make sure that everyone can access this information. And interestingly, it also talks about budgeting. Again, we've seen some figures from Yuliia, but we know that actually, obviously, different pieces of assistive technologies cost different amounts of money. However, the guidelines give a broad indication. For example, it says for physical accessibility, consider budgeting at least an additional 0.5 to 1% of your overall budget. For non-food items and assistive devices, consider budgeting at least an additional 3 to 4%. So what that means is when you're doing your budget for your humanitarian intervention, you need to put a budget line in specifically for assistive technology, assistive products. Now, that's not necessarily widely done, unfortunately, and I guess the question is, why not? It's also worth highlighting and reminding you might have already spoken about this as well, that this year's COSP, Sébastien spoke about it earlier, one of the 3 themes was around conflict, humanitarian emergencies and climate change. And in the discussion paper for states ahead of COSP, one of the guiding questions was, what measures must state parties take to increase the availability and the use of assistive technologies during and in the aftermath of disasters? What initiatives have been taken to address the unmet need for assistive technologies during and in the aftermath of disasters? Because the implication is here that we're not, there's more information to be had about this. We don't necessarily know all the answers, and there's more to be had. It partly is in preparation for the papers for the global report on assistive technology. I was part of a group that did an initial literature review. Actually, Kirsten was also part of the work. So it was WHO, UNICEF, and the Global Disability Innovation Hub. And we were looking at what we know already about assistive technology. And I want to just highlight a point that also was mentioned earlier. Yuliia, you mentioned about people who already had assistive devices but lose them. So we need to think about three groups of people, really. So there are persons who are injured and have an immediate need for assistive technology. That may be traumatic injuries, bomb blast injuries, maybe other injuries. It can also be people who had devices, but those devices were either left behind or lost or damaged. And we see this very common when people have to flee for their lives. Probably the last thing we're going to think about is your assistive technology. And then, of course, there are those people that never had assistive technology, but probably needed it, but perhaps hadn't had an assessment or weren't aware that they needed it, or had never had the potential to be assessed or identified. So it's not just the people who already have assistive technology, a whole range of group of people. I'm not going to belabor the point too much about our review. This is available online, and I'll give you the link to it after. But just to say, we had a look at an extensive range of documents and included about 76 in the final paper. And most of the findings, there were a different range of contexts, both conflict and disaster. And although we often separate conflict and disasters such as earthquakes or flooding, etc., oftentimes in practice there is quite a lot of overlap in the responses, for example, in planning, preparedness, response and recovery. The legal frameworks might be different, and I think that's really important. We've already touched upon some of those legal frameworks for conflict, for example, international humanitarian law, etc., may be slightly different to a more disaster-focused context. And of course, what we all know, and we've heard this time and time again today, is that the context really matters. And actually, what's interesting when you think about Ukraine is you would think Ukraine is maybe a higher income country than some of the other contexts where we see disasters and conflict happening. So one might expect the services prior to the disaster or the emergency to be of a higher standard or an increased standard. And in most humanitarian responses, the aim of the overall response is to ensure that people don't get less than they had before. That's the important thing. So the provision of services should equal that to which was provided before. Of course, many of you will know that the UN now have a nice mantra, the Build Back Better mantra. So in thinking about it must be equal to what people had before, we should also be thinking about how to improve it, whether that's to make systems more resilient, whether to improve access to healthcare services, to improve access to water and sanitation. So this idea about building back better is also one that the UN have really started to long now been using. In our review, we noticed a number of gaps though. And I think the first one, and again, this has perhaps been touched upon across all of the presentations, is need, identifying who needs assistance in the first place. I'd like to tell you that there was, every country has a list of people with disabilities that's really easy to access, but that's not the reality in most cases. For a start, many people with disabilities don't identify as such. Many people with disabilities don't want to necessarily be included on a list. And also we often think about how we are measuring and assessing disability. I think we touched upon already, Kirsten mentioned the use of the Washington Group questions this morning. Many of you probably know these. These are 6 questions that are used, for example, in census, and don't actually use the word disability at all. They use the word difficulty. And they are 6 questions about level of difficulty across 6 domains: hearing, seeing, communicating. And they have 4 response categories, from no difficulty to at all to a lot of difficulty. So these can be a proxy indicator for disability. A proxy indicator. It just gives you a prevalence. It doesn't give you any further details. It's not an assessment mechanism, and I think we have to be very clear about that. However, there is now growing evidence of the use of the Washington Group in humanitarian contexts. Many donors, including the UK government, in their humanitarian funding require agencies to report against sex, age and disability disaggregated data. So we're increasingly getting data that is sex, age and disability disaggregated. The question is, are we actually using that data to amend or change our responses? The other thing that we have little evidence of, particularly relating to assistive technology, and again this has come up a lot already today, hasn't it? This intersectional aspects, the role of age, the role of gender, how those things really impact on your level of access to goods, resources and services. And again, that's very context specific. It's also quite hard to measure. It's nuanced. It requires, you know, a different mechanism. You can't use the Washington Group, for example, you can use it to get some prevalence, but you need to go into much more detail for that. And that's increasingly being used in humanitarian response plans, etc. a lot of the work that's already been done really doesn't have much impact and outcome measures beyond those immediate rehabilitation needs. So here's where the right stuff comes in, right? Because actually, we can provide people with hearing aids, we can provide people with wheelchairs. That's fine, that's great. But does it enable them to do and be the things that they want to do? Does it enable children to go to school? Does it enable people to get jobs? Does it enable them to, access healthcare? That's the key bit. And those measures are not yet fully developed, I think. And that's where the links to the rights comes in much more strongly. Also, a lot of the work that's been done looking at assistive technology to date tends to look at immediate need, much less on longer term need, longer term recovery and rehabilitation support needs. And again, that's where, great that we can deliver products in the immediate and the long term, but in the longer term, what happens to those people who access? Needs will change over time. Products need renewing, all of these things. What happens in the longer term? I think very clear, we've spoken about the clusters, and oftentimes assistive technology is delivered through the health cluster, which is led by the World Health Organization. But what does that mean if you're a child with no obvious health needs, but you do need assistive technology to get to school? So your needs probably come under the education cluster. So the education cluster is a separate cluster to the health cluster. So there has to be some way of thinking about how those clusters communicate across to really think about how we can think about providing assistive technology outside of a health structure. I'm obviously supposed to be talking about health, so there are a lot of health requirements around assistive technology, but not all assistive technology is tied to a health need. Costs, there's very little evidence around what the actual cost. Probably many of you might have seen the famous WHO diagram of the cost of production of a hearing aid, which I think is somewhere in the region of $60. So by the time it gets delivered to the person who needs it, it's about $5,000 or $3,000. It incrementally increases because of the need to have a whole structure of support around it. So at the moment, the costs of AD have been hugely inflated, partly because they're seen as a niche need. So costs tend to be very high and very inflated. So this is something that the 80-20-30 program has been working on. And the last bit, and this again was illustrated really nicely by Yuliia, was this co-design of assistive technology. People with disabilities know what they want, but haven't really necessarily been directly involved in the design and production of assistive technologies, which has led to some probably not the most useful products for people. So in our literature, we had a number of themes. Most of the literature had focused on emergency needs, so preparedness, particularly things like stockpiling of the usual wheelchairs, etc. And that's particularly for what's called emergency medical teams. These tend to be teams that are going from higher income countries or donor countries to assist with, for example, an earthquake or a flood, etc. And most of the literature has looked at the health impact, so tends to be a very medicalised model of disability, not really thinking about disability from a biopsychosocial perspective. We had much less data on assessment or the types of assistive technology needs. Our paper makes a number of recommendations. I'm not going to go through them in detail here, but happy to talk about them after. For example, we said there needs to be a provision and coordination framework for humanitarian settings, a multi-stakeholder task force to take forward those recommendations, that donors and multilateral agencies should ring-fence humanitarian and development funding for coordination of AT, that humanitarian procurement teams should expand their supply catalogues. So many of these things chime a bit with what Yuliia was talking about, right? This lack of coordination, the need to have more products in catalogues, and that donors should make monitoring and evaluation a requirement of programming. And of course, we actually need to know much more about what works. So our literature review had a number of key messages. One of which is, of course, context matters. We know this, but it's worth underscoring it. It really does depend on not just which country you're in, but where you are in that country. So that's a huge input. There's a lack of evidence about what actually works for people with disabilities in terms of assistive technology, and a huge lack of information about need. There's a lack of responsibility and accountability of services, and a lack of coordination between actors. And I guess this is this idea a bit about the rights again, this prioritisation. How do you balance need here? There's a need for general assistive technology, older adults, people with chronic health conditions, versus the right to for example, education, and the need to provide services to ensure that people who need assistive technology have the access to those things. Many of you might have heard around some of the innovations that are happening, particularly 3D printing of prosthesis. This has become quite a cool thing. Again, there's some evidence about it, but still it's expensive, quite hard to deliver in many contexts. There's lots of design issues now. There's a UNICEF have an accessible latrine slab. But there are also some of the wider things that we need to think about. Kirsten mentioned already this morning about cash transfers, and that's a really useful. The evidence suggests in most humanitarian contexts, the best thing you can do, and this again was underscored by the presentation on Ukraine, is give people cash. It's the best thing you can do because most people know what they need to do themselves. Of course, the question, if you're a large multi-organization with a lot of people to supply cash to, how do you get a large amount of cash to a large amount of people? We're talking about a lot of cash. There are other ways, so cash transfers via mobile phone can be a very effective way of delivering it. Mobile phone services for health, mHealth services for health messaging. Again, research has shown that these have been very effective in humanitarian contexts. And I guess one thing I would say, particularly from an assistive technology point of view, is not to fall in the innovation trap, where technology becomes the answer rather than addressing underlying structural issues and inequalities for adults and children with disabilities. And I think that's a really important point. Assistive technology and these interventions only go some far, but we also need to be thinking about those underlying structural inequalities and how to address those. And again, our research really finds that we don't yet have best practice of what really works in humanitarian contexts. But we did do some research to look at what people are currently doing in humanitarian contexts. We looked at 2 countries, so Jordan, where we looked at camps and host communities in Jordan, so that's including Za'atari refugee camp, but not only Za'atari. So the refugees there are mainly from Syria and Yemen. And we also looked in Bangladesh, in Cox's Bazar. Again, long-term refugee context, sorry, I'm not allowed to call them refugees, Rohingya people from Myanmar. So those 2 contexts were areas where people have come from another country, cross an international border, and are in another country. They're not displaced internally, they're from another country into camps and host communities. Commonly now, in Bangladesh, these are mainly large camps. Again, it's a very political thing I can talk about after, but people are settled in camps, and the camps are they're perhaps not so formalised because for the Bangladeshi government, there may be issues around recognising them as formal refugees. In Jordan, there are camps for the Yemeni and Syrian, etc., refugees, but many people have self-settled with host and communities. So that might be living in other people's homes, etc. So what we thought was flip this question around a bit. We know there's lots of gaps around assistive technology, but what are people already doing that are in those contexts? So what do we know about those things? How is need currently met? What are the gaps, and what do we need to know differently to ensure provision? So we interviewed a total of 76 people in the 2 countries. And again, this has been published, so I won't belabor the point, but was really to understand how people were currently or had currently access to assistive technologies. And you probably wouldn't be too surprised to know that most of them had accessed it through their own devices and going to a shop and buying it. But we analysed the data through what the WHO called the 5 Ps framework, which is products, so the kinds of ATs developed and how is it used in humanitarian settings, the people who uses and creates assistive technology in humanitarian settings, and that includes the people who work in the delivery of it, so physiotherapists, occupational therapists, etc. Provision, how is AT in humanitarian settings currently funded, and how sustainable are these models? That's a really key question, right? The whole issue in humanitarian work is how sustainable. Linked to that is the whole issue of another P, procurement. How does place, really important P, how does place impact on access? And finally, policy. I think we've heard a lot about policies not working terribly effectively. So how is AT in humanitarian settings influenced by existing policy frameworks? Again, this has been published, so I'm just going to skim these. But what we know is that most AT provision in these settings, as Yuliia illustrated, is ad hoc. There isn't a systematic way this is being delivered. Most people end up having to go to a shop or a market and buy it themselves. But obviously, it goes without saying that devices alone, assistive technology on its own, doesn't ensure wider inclusion. There's been very little research around the nexus between social protection and humanitarian responses, particularly for people with disabilities. And the reason that's important is Yuliia talked about protection and the protection cluster. The role of the UN protection cluster is to provide humanitarian protection for people with disabilities. But there's also a whole issue about social protection and cash delivery for people with disabilities. Having access to funding might enable people to buy assistive devices and technologies if they need them. Many of the people we interviewed lacked support mechanisms to enable them to access their rights to work. So even if they had assistive technology, for example, the Rohingya people in Bangladesh, even if they had assistive technology, the conditions in the camps are not enabling them to go out, find jobs, to leave, they're muddy, they're very hilly, they're deeply inaccessible. So even if people have the assistive technology, they don't necessarily have the ability to get out and get jobs. Another thing, and I think this is probably really important, is that a lot of people with disabilities were relying on families or other members of family members or neighbours for their assistance. So that does raise the question: if you haven't got a family member who's helping you, who's looking after you, you really have to rely on your neighbours. And it comes back to the question you asked, Julia. Who is responsible? If it's not the state or the agencies, who is responsible for delivering support for people with disabilities? So what else? We know that there's a limited investment in this, but we also know that within healthcare systems in general, even before a humanitarian emergency, assistive devices or assistive products is a relatively small pool of funding in a much, much wider healthcare system. And I think, we all have probably experienced this ourselves when we've gone to look at a rehabilitation hospital somewhere. Rehabilitation, assistive technologies is a tiny, tiny part of most healthcare budgets and never seen as a really significant need in a healthcare system. Think about that. Think about the people that are in hospital who have strokes, who need assistive technology. Think about older adults who need assistive technology. Think about children. I think we haven't probably done ourselves any services by not having that good, accurate data about what the pre-disaster or pre-humanitarian emergency needs were to really help us understand what a good, well-funded healthcare system that includes assistive technology would look like. And again, from a healthcare perspective, we certainly need more translational work that looks at how we develop and deliver effective evidence-based health and rehabilitation services. I think we've kind of taken for granted some of the models for a long time, and they're not necessarily been robustly tested in different contexts and settings. We made a number of recommendations in our report. Of course, it goes without saying that assistive technology should be part of core healthcare provision in emergency settings. I'll come back to that in a sec. Where assistive technology cannot be provided and fitted by a healthcare professional, we need users to be provided with appropriate guidance on the type of AT and the safe and effective use of assistive technology. Bad assistive technology is worse sometimes than none at all. Again, we need to leverage those networks of AT providers. There are many, many places in markets, in informal settlements where people go to buy assistive technology, and they could be leveraged to be much more used than they currently are. They could be points of contact for people, they could be points of information for people. And I think increasingly, Kirsten touched upon the idea of the localization agenda this morning. Perhaps linked to that is this much sort of clearer idea about local production, repair and distribution of assistive technologies. 90% of it, okay, maybe not 90%, but most assistive technology is manufactured in China and imported. So actually, whether you buy it from the local market or you get it from the local healthcare centre, it's probably the same device and it's probably been imported in from China. And that's not bad, that might be the right use of things, but we then know that many, many of those things end up in scrap heaps, or they're, they can't be repaired, or they're thrown away because they're broken. So we need to really thinking about, this idea of a more circular economy. How do we invest in local production? This could be a driver for much better local manufacturing services. And again, it links with the localization agenda. And of course, we need to identify much better the opportunities for innovation in assistive technology. There's some really innovative work being done around 3D printing, etc. People. So we know that allied health professionals, physios, OTs, etc., are vital, but have been massively underfunded and massively excluded from formal healthcare structures and programs. And so that probably needs to really shift a bit. again, somebody touched upon this, and I think it was talking about the idea of post-conflict recompense. I think Sébastien might have touched upon this when he was talking about Rwanda. You know, we know that so far in many, many countries, there's still very limited social protection mechanisms for people with disabilities. So that's providing funding or money, universal money for people with disabilities, and or injury compensation. Again, there's huge issues around, especially when there have been things like truth and reconciliation commissions. The whole issue of who is a war victim is often very contested and very challenging. So how do people get access to compensation? But of course, in link to that is the idea that we need to challenge and address stigma, the whole issue of inaccessible environments in camps and refugee settings, and how we support and in people with disabilities to really, as you said, Yuliia, manage them. You know, they know what people with disabilities themselves want: jobs, education, employment, exactly like everyone else, but they need much more support to get that in humanitarian context. In terms of provision, we need to think through much more joined up provision around assistive technology. For too long, it's been the kind of out there, separate to other healthcare mechanisms, but that's hopefully will change. Think about how healthcare systems have to join up, for example, for vaccine production. If COVID has shown us nothing, it's how we need to join up a healthcare system to ensure that right from the manufacturing, distribution and delivery across the whole healthcare system. Come back to the point about local production and manufacturing. I touched very briefly on this idea about budgeting. Very clearly, I think we need to really say that within humanitarian response plans, or HRPs, that there is now budget for assistive technology. According to some donors, the budget should be as high as 3 to 7% for specialised non-food items such as assistive devices and mobility equipment. Basically, if it's in a humanitarian response plan, it will, in theory, get done. Of course, the idea that the humanitarian response plan, as delivered by the UN, actually gets fully funded. In most countries, Ukraine might be an exception, the humanitarian response plan doesn't, the funding required is well short of what's actually donated. We probably need to develop a much more standardised approach to AT assessment and provision in humanitarian settings. And I think this has come up many, many times, the idea about place, promoting collaboration and coordination between sectors and the UN clusters to ensure joined up provision of AT for adults and children. I think that idea of coordination across the clusters is one that comes up time and time again. And we know that infrastructure guidelines are useful and should be explored. I wanted to a little bit finish on some policy work that's already happening, just so there are some good news. We know that there are been now some specific policies around provision of AT in humanitarian emergencies, and that's in line with the recommendation 9 of the Global Report on Assistive Technology. We also know that assistive products need to be prioritised and available through appropriate procurement routes, and again I will talk about that in a sec. Something that has been discussed but as yet has not been fully delivered, or it might be delivered, is the idea, many of you might know that there's an assistive priority products list that the WHO delivered, the 50 assistive priority products list that should be available everywhere. There is now discussions to have one specifically for humanitarian context, whether that's whether the products would be different or not is perhaps interesting. We did some work on inclusive education, looking at access to assistive technologies in inclusive education, and actually the products needed are pretty much the ones that are already there in the APL, so it's just really thinking about ensuring that the products that are listed in the APL are actually available. And again, of course, more research. I'm a researcher, I have to say that. The Global Report on Assistive Technology, it's interesting for me that a lot of the recommendations are happily in line with our research, so that's probably useful. Again, thinking about the usual things, addressing having a task force, thinking about how to raise awareness about the need for humanitarians to deliver assistive technology, thinking about a response plan, integrate it across sectors, etc. There is some good news. I'm not going to read all these out. These are all in the global report. Please do read it. But there is some work being done. So there's already now a working group on assistive technology and humanitarian emergencies within the WHO. The WHO have piloted what's called AT6 and AT10 in Ukraine. They are the list of 6 and 10 priority products. So the key thing to remember about the cluster system is that The organisation that leads the cluster, so the health cluster is led by the WHO, their mandate is also to be the provider of last resort. So what that actually means is if no one else can provide it, they are required to provide these devices. It also means that these are now being provided as part of the WHO response. So I don't know, you probably can't see it's too small there, but there are things like crutches, walking sticks, walking frames, wheelchairs. The 10 includes more things around incontinence devices. So these are just seen as the absolute minimum products that should be delivered in a humanitarian emergency. It's a start. So again, that will be evaluated and assessed. UNICEF have a procurement manual now about the types of devices, the specification of devices in humanitarian emergencies. And I think that's a really useful place to start. So we see, though not ideal, there are training packages going on for allied physiotherapists, etc., in humanitarian emergencies. So although it feels slow, there is progress being made here. Nothing that in the UN happens that fast. It requires a lot of bureaucracy, but I think there is work hopefully happening in this. And although it won't necessarily solve all of the issues that we've heard about today, hopefully it will enable that people with disabilities to absolutely be included in the wider issues such as education, health, and other areas of work. As I said, I've whizzed through this, but our report is available. So the literature review is available online, free to download. The report is available online, free to download. And if you're interested to look more around how to use the Washington Group questions in humanitarian action, I've put a link to the humanitarian inclusion work on that area. And that's it. Whiz through.
Thank you very much, Professor, for sharing with us your expertise.